is done, the TSH, which is the number that's off on you, is not reliable because your pituitary has been affected, right?
Yeah.
An endocrinologist reviewed your chart on March 22nd. They didn't meet with you. This is called an electronic consultation. And they said, okay, and that you had gamma knife pituitary radiation.
Yes.
So you're at risk of developing this. Let me see here. They said they may want to see you in person, and that might be good. So your cortisol level 7 days ago was a little low. Let me see what time this was collected. This was it in the afternoon. Let's check it again. So they said early morning and ACTH level. Okay. So we're going to do that. And then I'm going to have them see you too, because I think it's important. Because if your adrenal gland is not working because your pituitary got operated on, when you have your surgery, they just have to give you steroids during the surgery. That's why I was asking you that question earlier.
Yeah.
If anyone ever told you you need to have steroids when you get sick or when you have surgery. So I'm looking at your endocrinologist note, and they're saying to repeat this blood test. So the best time to do this blood test is before 8 a.m. in the morning. Because they did one on you in the evening, and it's not as good when you do it in the evening. So what we'll do is we'll do this test, and we'll do it in the morning.
It depends on the sleeping cycle or something.
You can even come pretty early. I know sometimes people think phlebotomy breaks your fast, like draining blood for a blood test, but you can come pretty early. I can ask them the earliest you can
because
come.
we take suhoor really late, you know, so
Yeah.
it does not affect.
What time do you take suhoor?
Like around 5 a.m.
Yeah, that's tough. So I think, what I would say is that this is important to know. So if giving blood is going to break your fast, maybe just don't fast on that day to do this.
Okay.
And this is an excusable thing, right? You're getting tested to be cleared for surgery for cancer, right? So that it's allowable in Islamic law to break fast for medical reasons.
Yeah.
This is a legitimate medical reason because this doctor never saw you, but they were saying that because you had gamma knife on your pituitary, they wanted to know what your cortisol level was in the morning. If it's normal, probably don't need to worry at all. If it's still low, then we probably need to give you some steroids during your surgery. Because if they do it, and if you need steroids during your surgery and they don't give it to you, your blood pressure may drop during the surgery. Because it's pituitary. Because the pituitary controls all your hormone glands, right? And your adrenal gland is on top of your kidney, and it secretes cortisone in your body, normal cortisone, right?
Yes.
That keeps your blood pressure normal. If your adrenal glands aren't working properly because your pituitary gland had gamma knife, then when your body's in surgery, it's a stress for your body. So your body secretes cortisone. But if your pituitary is not working, your body will not secrete cortisone, and your blood pressure may drop. So it doesn't mean you can't have surgery. It just means that if you have low cortisol and you have pituitary problems and you need the surgery, then we do the surgery, but we give you steroids during the surgery, which is they do it all the time for people that have this problem. So we need to figure this out.
Okay.
So I think we should do this tomorrow morning. I don't think you should fast tomorrow morning. You should just do this test. We'll do it before, we'll say before 7 a.m., before 8 a.m.
Okay.
Right, and then we'll get these results back.
Okay.
And then we'll ask the endocrinologist to meet with you too. And we'll try to get all of this done before your surgery, so it's clear. Just try and make sure we don't rush you in surgery and ignore these things, right? So let's do that. And this has, let's see, before 8 a.m., we'll do it tomorrow. And then, so I will say this. We'll need to repeat her AM cortisol and ACTH to determine if there's any evidence of adrenal insufficiency given her prior gamma knife pituitary surgery, period. If these tests are normal, then, and I'll say this. We'll figure it out.
طيبة أموري طيبة حبيبتي أموري طيبة إن شاء الله أموري طيبة.
I'm gonna say make selected text edible. We will repeat an AM cortisol and ACTH. We'll place consultation with endocrinology PGA clinic. Alright, so we'll do that. And I'll pay attention to all of these things while Dr. Sadek is away.
Okay.
And if I have to call the endocrinologist, I'll call them.
Okay, thank you.
Yeah. Endocrinology e-consult recommended face-to-face consultation, comma, history of gamma knife, pituitary surgery, comma, will need to have laparoscopic hysterectomy for endometrial cancer, comma, question about stress dose steroids during surgery. Alright, we'll get those in, and then if you see an appointment with the endocrinologist that's far away, don't worry, we'll speed it up, and
Okay.
or I'll call them and tell them, and they'll tell me what to do.
Alright.
Good, good.
So, and I'll tell them you have diabetes too, and we'll clear all this. So this is what I said. I was like, hey,
Okay.
she has a new diagnosis of diabetes. We gave her medication, metformin. We're gonna do diabetes education, but it's very mild and you have no symptoms.
Okay.
Your daughter's concerned about your breathing at night, so we're gonna just check to see if you have sleep apnea.
Yes.
Whether you have it or not, it's not gonna change your surgery. The
Alright.
anesthesiologist just needs to know.
Okay.
And then we're gonna check your AM cortisol and your ACTH, which is the hormone your pituitary sends to your adrenal gland to make
Yes.
cortisol.
Okay.
If there's any evidence of adrenal insufficiency, that's what we're looking for,
Alright.
then we'll need to give you stress dose steroids. But I said if these tests are normal, you go have your surgery, you're medically cleared.
Inshallah.
I mean, I still think you're medically cleared, but we need to make sure we don't ignore that.
Yes.
If there is a problem, the only change we really have to do is give you the steroids during surgery.
All right.
Right, so sometimes they'll give you a replacement, which is like 5 milligrams twice a day that you take to replace your normal steroids. Then when your surgery happens, you double it.
Okay.
And then you double, and then once your surgery part is done, you go back to 5. So that's kind of how it works.
Okay.
And the same thing would be true if you got sick. If you got COVID or flu, you just double it because it's replacing your normal response. And then when you feel better, you go back to normal. So that's how it works. So it's not a big deal if it happens. We just have to give you a medication for it.
Okay.
But let's just see. They didn't say that you have it. They just said we need to just check it in the morning to make sure it's not low in the morning. If you get a normal number in the morning, put it out of your mind.
Okay.
Don't think about it. We'll move on with surgery.
Okay.
Okay, but because your history is different.
Mm-hmm.
They had surgery on your pituitary,
Yes.
and so you're at risk of having multiple hormone problems.
Mm-hmm.
So we just have to be vigilant and not ignore it. Because the last thing we need is you to have a problem during the surgery, right?
All right.
And it's a good thing there's still some time before the
Okay.
surgery, right?
Okay. Yes.
Alright, so we're gonna do all those things, and I'll put in here diabetes education, overnight oximetry, AM cortisol and ACTH to be done before 8 a.m. Okay. Endocrinology PGA consult. And I'll pay attention to all these things. I'm here this week, next week, right? So I'll be here. Let me see what your schedule looks like. See if they added those things. Alright, so we got you endocrinology April 3rd. Perfect.
April 3rd.
Yeah,
Okay.
perfect. Great.
Okay.
And then we're gonna do the blood tests
Tomorrow.
tomorrow. Let me see. Oh, they scheduled it for today. I gotta tell them to do it tomorrow.
All right.
Alright. Yeah, so I think tomorrow is a day where it's okay for you not to fast to do this
Okay.
test.
Yes.
You know. Some people don't think giving blood breaks their fast. So if you're one of those people,
I
you
think, yeah.
you still want to fast.
Yeah.
That's fine with me.
Yeah.
But if you're worried that giving the blood breaks your fast, then
Yeah.
just don't fast,
Fast.
tomorrow.
Yeah. Okay.
The only problem, doctor, is
Yeah.
suhoor.
Yeah.
Is it okay if we do the blood test early morning and she had like late suhoor?
Yeah, it's this test you don't have to do fasting.
Yes.
Ah.
You see, yeah, like you can. This is a cortisol. The
Yeah.
important part of the cortisol test is that you do it before 8 a.m.
Yeah.
But it doesn't matter if you eat or you didn't eat or anything like that.
Yes,
Yeah.
Okay.
How long ago did you travel here?
You mean the first time
Yeah.
you came to Rochester?
No, like for this visit, for this cancer issue.
Yeah.
On the 18th of March.
Of March? Okay, because sometimes when people travel from different time zones, it messes up your cortisol too.
Yeah.
Oh,
Because
right.
if your sleep cycle is messed up, it affects the cortisol.
Right.
Sometimes it's not the easiest thing to interpret. So I think meeting with the endocrinologist is a good idea. So this is a pituitary endocrinologist
Yeah.
that you're going to meet with, Dr. Erickson, which is really good.
Yeah.
You're going to see her on April 3rd. So
Alright.
she's going to help us figure this out because it's not always the easiest thing. When you travel from a different time zone
Okay.
and you check morning cortisol, it may be falsely low
All right.
because your circadian rhythm of your
Yes.
sleep is disrupted.
All right.
So it's not always the easiest thing to interpret. I'm going to say please reschedule labs tomorrow morning before 8 a.m. To me, it doesn't matter when you do it as long as it's before 8. If you do it after 8, then the result is not as good.
Yeah. Okay. Okay.
Alright, so that's good, that's good. The diabetes education is going to be a visit with a nutritionist, and then there's a group education for people that have new diabetes. That's April 8th.
April 8th. Okay.
Yeah. I don't know if Eid is on that day or not.
Oh yeah.
Right.
Can you check it?
I think it might be April 9th is Eid.
Yeah, I think
Right,
so.
so I think you're okay.
9.
Yeah. So this is just education. It's no blood test,
Yeah,
nothing. You
yeah,
just go
yeah.
and they teach you.
Yes.
Right. So that's April 8th.
All right.
So that's when we got that scheduled.
Okay.
9 actually.
Oh, okay.
But you want me to print you out a new schedule?
Yes,
Yeah.
So we'll do
please.
that, and I'll have them move the light. And then you can go today and pick up the oxygen test for the sleep apnea.
Okay.
It'll be on your schedule.
Okay.
And I'll pay attention to all of these things.
Thank
okay?
you. God
And
bless
then
you.
if you have any questions, just message us through the portal.
Okay.
I'm here covering for Dr. Sadiq, so I can
Okay.
help out.
All right.
Yeah.
By the way, doctor, my endocrinologist doctor in Mayo Clinic,
Mm-hmm.
John Morris, is he still here?
Yes, I think so.
Yeah.
He may have retired, but I feel like in
Oh.
the last 2 years, he's definitely seen some of my patients.
All right.
Let me check.
And the
Because we can ask him too, because he knows.
Yeah. And Dr. Atkinson's, who
Did your surgery?
Yeah.
Yeah, he's still here.
All right.
The neurosurgeon?
Yeah.
Yeah, he's still here. John Morris, are you still here? Looks like he's still here.
Oh yeah.
He says he's emeritus. When you're emeritus, that usually means you've retired.
All right.
Yeah. So probably not anymore. 'Cause
Yeah.
when you're like physician emeritus, it
Oh.
usually means that you used to work at Mayo and they gave you this honorary appointment
Oh, yeah.
after retirement.
All
So
right.
yeah. He doesn't have a pager number listed, so I think
Oh.
he's retired now.
Yeah.
Yeah, probably pretty recently. Maybe
Uh-huh.
he retired like during COVID.
Uh-huh.
Yeah. Okay, but Dr. Atkinson neurosurgery still practices, I'm pretty sure.
Yeah.
Yeah, John Atkinson.
Yeah,
Yeah,
yes.
he's still operating.
Yeah.
Yeah. Okay. All right. So why don't you wait here? I will have them come and give you a printed out schedule,
Okay.
and then I'll see the blood work tomorrow. We'll talk. You're
Okay.
gonna see Dr. Erickson on April 3rd. You're gonna get diabetes education April 8th.
All right.
I gave you medication for diabetes. You can pick it up later today.
All right.
Pharmacy is called metformin. It's a
Yeah.
pill. You can take it after iftar, after your thyroid
Yeah.
medication,
Yeah.
right? Take it with food,
All right.
because if you don't, it may give you diarrhea. But
All
this
right.
one, the long-acting one, less diarrhea,
Okay.
and it's only once a day instead of
Okay.
twice a day, which is easier during Ramadan, right?
Mhm.
So
Yeah.
okay. All right, questions.
Very good.
I think
Okay.
we covered
Mm.
it.
Thank you, doctor. God bless you. Thank you.
Yeah, of course. One day at a time, one
Yeah.
problem at a time. I
Yes.
think you're set up very nicely, so
Yes.
things will be good. If there's any concerns, question, just reach out.
Sure. Sure. Thank you.
So I'll go get you that schedule, and then we'll keep an eye on those things, okay?
Okay.
Awesome.
Thanks, Doctor.
Thank you, doctor.
Yeah.
Have a wonderful day.
Assalamu alaikum.
Alaikum salam. شاء الله كل المسلمين